Awarded by Philadelphia Magazine a top doc 5 times. Some of us haven't even made it a half a time. He's been many associates, clinical assistants, or professorships at various medical schools in the city of Philadelphia. The present title is Medical Director, the Comprehensive Breast Center at Bryn Mawr Hospital from 2002 to the present. We invited him here tonight because this is a Distinguished Service Award, and we could think of no one better to award it this year. Now, before we give that award, there are a few people here who would like to make a few comments. No, I'm not inviting Tony Zabacosta up here. We're going to start with Dave Rose. Dave, would you like to come up and say a few words?
I had the opportunity to participate on that video, and I'd just like to take a few moments to sort of expand. First of all, I'll tell you all it's great to be here with all of you. I mean, Tom, I'm glad we're having this for you because there are so many faces that we don't see much anymore. I remember when I started here, we used to all get together 2-3 times a year for varying events, and we don't anymore. We need to do it more often. We should figure out how to do it. I've known Tom for 27 years, and those of you who are here, most of you probably know that I'm here because he's here. He recruited me to come down from New York. I went to Haverford College, and when I told my wife I was going to look at a job in Bryn Mawr, she said, "David, you can't go back to college." And as persuasive as Tom could be, we came down. Alicia, sort of in deference to me, said, "Okay, we'll go visit the shrine," as she referred to Haverford, Shrine Haverford. We came down, and Tom, as persuasive as he could be, he sold her on Bryn Mawr and the hospital, and probably the best thing I ever did. So I owe that to Tom, which I'm uniquely grateful for. Tom and I were partners in practice and business for 20 years. We've been partners in medicine for the 27 years I've been here, and I am sure we'll be partners. This is no slight to AK, but in life to some extent forever. You know, he's the closest thing I have to a brother at this point, so I feel especially gifted to be up here. I tell the medical students and residents, when you look at your teaching faculty in surgery, there are 3 parts of surgery. One is the clinical piece, the second is the research piece, and the third is the teaching piece. And you find very few people that you find as faculty members that are really truly capable of being superb at all 3. I always say that in my career I've seen maybe 2 or 3 that could do each piece of it superbly. Generally, if you can make yourself be great at 2 of them, you're going to be a star. Tom's an unusual character. He can do them all. I mean, there is nobody that can do the combination in Bryn Mawr of the clinical piece, the teaching piece, and the research piece better than he has done it. And I don't know if there ever will be in surgery again. The other thing that I think of Tom that's really special is all these years I went to meetings at the hospital and we talked about vision and mission and mission and vision. And I was always confused. What's a vision? What's a mission? But I will tell you that Tom had a vision from the day I came to Bryn Mawr that he made his mission. I came to Bryn Mawr and he already had a big breast practice. Within a year of being here, and this is 1983, if a woman needed a mammogram, she had a lump in her breast, the hospital had 1 mammogram unit for the whole hospital. She'd have to wait 4 weeks, 5 weeks to find out what the mammogram showed. I mean, first of all, she'd wait 5 weeks to get the mammogram and then wait weeks to get the result. He tried to convince the hospital to put another unit in. They wouldn't, so what did he do? He went ahead and put one in the office. About a year later, Tom decided that breast ultrasound would help with breast diagnostics. And many of you probably don't remember the old water bath ultrasound. Went to the hospital and said, "This is a great idea." They didn't want to do it. What did he do? He put it in the office. About 2-3 years later, and this is in the mid-80s, he decided the right way to provide care was to do it as a group, where physicians work together. Surgeons, radiologists shouldn't be separate. And he ended up putting a radiologist in the office to read films in the office at the same time they were done. Think about it. Patients were going to hear about their films and go over them with a radiologist. This was in the mid-80s. I mean, this was really the beginning of a breast center. This was Tom's vision. And I think about it because if you think about where we are now, he had this vision 20 years ago, and everyone's all hot to trot that we have a breast center today in 2009. Tom knew this in 1982, 83, 84, 85. So he's the only one I know who really knows what a vision and a mission are. They're the same for him. Lastly, the only comment I can make is I know lots of you are committed to Bryn Mawr Hospital, but this guy is more of a salesperson for this institution and this medical community than anyone I've ever met. He's made more of an impression upon me and his patients, and I, can only say thank you. He's done an outstanding job, and stay with us for 20 more years. Thanks all.
I would like to invite Steve Cohen up to say a few words. Steve.
Thank you. I'm very delighted to be involved in honoring Dr. Frazier. And I remember when I first was coming out to Bryn Mawr, and the chairman of my program said, if you're going to Bryn Mawr, there's this surgeon out there who's really fantastic. He spends a lot of time with patients. He's really, patients love him. And the only thing about him is he does this weird thing, which is definitely not the right way, which is they're involved in doing this immediate reconstruction in breast cancer surgery after mastectomy. And that is definitely the wrong thing to be doing, but other than that, he's this great surgeon. So I came out to Bryn Mawr, and I hadn't met Dr. Frazier, and actually I met him, or became aware of him at a conference. I think about a month before I was about to start, there was a breast conference at the Adams Mark, I believe, which is no longer standing. And someone pointed out Dr. Frazier, and they said, that's Dr. Frazier, this fantastic surgeon at Bryn Mawr. And I said to myself, it doesn't really look like anything that special, but seemed like a decent, looking person, a normal looking person. They said, he drives he drives a Porsche, and it has a bulldog on the hood. So I said, whoa, that's a very cool thing to be doing. So I came out to Bryn Mawr very, recently trained, and figured I was very knowledgeable, and I had a patient in common with Dr. Frazier. And I think it was a patient who had a lymph node enlarged in her armpit, one of my first patients. And I said, to Dr. Frazier, I think we ought to do this and that. And he said something like, well, that's not right. BO4 said this, then it was this percent, and that percent of this. And I was like, whoa, I don't think I could pull out all those percentages and really, be that expert. I think I better start doing my homework. But that's, shortly after that, I began to realize that Dr. Frazier really knew his stuff. And for a long time, my group, which was Drs. Growney and Silvers and Bond and myself, and, always thought that if we were sending a patient to Dr. Frazier and Rose or Dr. Noon, that they were at the absolute top of what they could get nationally. But over the years, I think I have become aware that Dr. Frazier is just, not only a phenomenal communicator with patients, but really makes patients feel so completely comfortable that by the time they come to me, they're like saying, okay, we have to be here too. We'd really like to go back and see Dr. Frazier, but we'll come and talk to you a little bit too. But I think the thing that I want to just mention a little bit is Dr. Frazier really has done work that has had a national importance.